I think the way I'd like to start this, because you and I are very impromptu and we kind of talk from our heart and also what comes up in our thought processes as we are sharing our knowledge and, years and years of working with teens and adults. We know that many of the individuals that come to the Smart Center have parents or caregivers involved in their care. So I think I'd like to talk about the fact that for many of our, let's say, teens and young adults who come to us, how do we help the adults in their lives, their parents often with teenagers, be able to help implement all of the strategies that we're recommending? And I think that's going to be important. So I think as we talk about this, Dr. Jenna, I think we should also bring in how others in their lives can help support. And I'd like to start with how many of the individuals with selective mutism have that passenger in the car way of living versus being a driver in their own car. And I'm not talking literally, right? Do you want to touch on that? Because this is such a big part of what we talk about when we work and treat families with teens and adults and how we navigate this.
Yeah, no, I mean, you bring up a lot of good points. And I do think that many times when we have teens come and young adults, it's the parents that we have to talk a lot to, because I think that a lot of times, especially with the population that we work with, there's a lot of dependency. There's a lot of young adults and teens that still depend on a lot of their parents in many ways, which is typical. But I think that a lot of those learned behaviors, even from parents, have to be kind of pulled back a little bit. So I think the idea of the passenger in the car, and Dr. E, you mentioned this a lot at our Communicamps, which is great, is the idea that many times if you envision yourself in the passenger of the car, so pretend that you're kind of the passenger in the car, and whether it's your spouse, your partner, your sibling, your parent, someone's driving you, you're kind of just driving, maybe you're going to dinner that night. And let's say you're just like looking at your phone, you're not really paying attention to the road, right? And you get there, and then pretend that we were to say, okay, now I want you to drive back. Now we're going to switch spots. And now you're going to now sit in the driver's seat. The person that was sitting in the driver's seat is going to sit in the passenger seat. Most people would almost have this like fight or flight response of like, wait a minute, what? Like I have to now navigate everything on my own. I wasn't even paying attention. So I think the idea of the passenger in the car is this notion that many of our teenagers and young adults only really are the passenger in the car. They're not really paying attention to the nitty-gritties of social interaction and engagement and communication. So when we then place that expectation and we say, okay, well, now you sit in the driver's seat, I want you to now give your order, they might not even know those skills yet because their whole life, and for let's say a 16-year-old, for 16 years, they were never doing that. So I think parents have to understand that idea, that's a great concept, but it takes a lot of us then stepping back for then your child or your young adult to then become that driver. And we might need to teach them how to drive before they could just become the driver. So that's how I usually explain it, because I think many times it's easy to just throw yourself into the seat. But I think that really thinking about what that looks like is going to take a lot of steps to get there.
You explained it honestly perfectly. And that's exactly right. And I think the parents of many of our teens and young adults that are here, they're probably saying to themselves, wow, you're right. Like I tend to navigate. I often tell my child what to say and how to say it, like say hello, tell them what you want to eat. And so they're basically driving, even when they're almost like the backstreet driver of the car, even when the teen is in the driver's seat. And so what we're trying to do in order to build social communication confidence, but just even confidence and independence, is to be able to shift roles, but in a very gradual, respectful way, because that philosophy of now you can do it, you need to do it, you have to do it, you should do it. Of course, I would like to say I'm exaggerating that, but I'm not. There are many parents when we sit in session that are very much about, come on, honey, you need to do it. In order to get into that honors class or to be able to drive a car yourself, in order to be able to go to college, in order to be able to have that job or to make your needs, you've got to do it. You got to do it. But without that navigation system that they learn themselves, it just doesn't work. And you end up creating often more anxiety, more avoidance in our kids. And when we meet them where they're at, wherever that is, they then start to feel safe and are willing to take some steps. So in order to become a confident social communicator, someone that's not only verbal, but can be initiative, more elaborative, more confident, and presents that and projects that energy out, they need to be independent, way more independent than most of our clients and patients are. And so much of our work is, yes, building social communication skills and becoming a verbal communicator. But what about their confidence level? What about their sense of independence? And so that's what today is about, is how do we help them become a more independent individual where parents can kind of take some steps back and they can build that, because through independence is going to become confidence, and through confidence is going to fuel social communication progression, because they're going to be more willing to take a risk when they're confident, when they feel more independent. And that's how it all works together.